I left school first, I wasn't sure what I wanted to do. I'd got my 7 grades and 3 hires. There was 1 hire that I didn't get, so I couldn't decide between nursing, going into the police, or being a teacher. So I decided to take a year out and go up to the local college, and I did a year's course in computer programming, which I really enjoyed. It was really good. It gave me time to think about what I did want to do. When I left college, I got a job with a local glazing company. I did lots of things. I'd learnt on the computer course. I was doing wages. I was doing quotes. I did a course at the college as well on word processing, so I could actually learn some admin skills because I was wanting letters done too. So 6 months into working for the local glazier firm, I was speaking to somebody that was quite inspirational, and I decided that's what I wanted to do. I wanted to go and be a nurse. I applied for the nurse training locally and got accepted 6 months later to start my nurse training locally, which meant 18 months on the island and 18 months in Inverness. The training back then, for the 18 months in Stornoway, it was 8 weeks in college, and then you were 16 weeks in geriatric ward. I think it was 12 weeks in medical, 12 weeks in surgical, and 4 weeks on the community, and then 4 weeks also with the community psychiatric team. And I knew from quite early on I really enjoyed the community. I was much more suited to that. On the mainland, it was the same thing again. For the 4 weeks on the community, for the 10 weeks geriatrics, I was in Invergordon, which I thoroughly enjoyed, in the old hospital. For the 4 weeks on district, I ended up in Skye for 4 weeks, which really inspired me. The district nurse midwife there was just a brilliant, inspirational. And that's when I decided I wanted to be a community nurse midwife rather than a hospital nurse, although I know there's lots of different types of nurses. That's where I felt most comfortable. That's where I could make the biggest difference. At present, I'm currently the Parkinson's disease specialist nurse for NHS Western Isles. My role is quite varied. It varies from day to day, which I enjoy because each day is different. A lot of my work is community based, so going out to see people and assessing them in their own homes. I also do clinics at the hospital occasionally, and there is a telemedicine every 5 weeks where we link up with Glasgow and the consultant neurologist there to save people having to travel off the island. There's also admin involved, so I can still use my computer skills from many years ago. And a lot of skills that I have are transferable, which is one of the good things about being a nurse. There's quite a lot of skills, but probably one of the most important skills is communication and being able to understand what people are saying, listening to what people are saying. And really, you have to listen hard, because it's not about what you think that person needs, it's about listening to what their needs are, picking up on cues for that, being able to communicate that to other health professionals that they need to be referred to. It's really important. Other skills that are really important, and it's to do with the active listening, is being an advocate for the patient, listening and making sure that their voices are heard and their needs met where at all possible, and certainly their wants and wishes. That's very important. Also, I'm learning all the time. I'm learning something new. You never stop learning, so continued development of my role. There are new conditions coming up all the time. There are conditions that I don't know about neurological wise. I find it really interesting, and I've still got a thirst for knowledge. There's lots of skills needed. Also, being kind to people and being kind to each other, being kind to yourself, that's really important. There's lots of jobs in the NHS, and what you start off with, I started off as a student nurse. I thought I'd be working in a hospital. I ended up working in the community, being a midwife. I was able to travel with it. So you're not tied to anything. If you start off as a nurse, that's just one very small aspect. You can develop your role, you can change your mind if you want, if nursing doesn't suit you. I mean, I started off doing computing, it didn't suit me, but I was able to take these skills into nursing. You might want to start off as a physio or an occupational therapist, and then you might want to decide to become a nurse. There's no wrong and there's no right way. It's whatever you choose to do that's important. You have to apply for a lot of jobs to get to one interview. I applied for 30 jobs, got one interview. It was for Germany. It was a good interview, it sounded really good, so I thought, why not go off travelling? I was young enough to do it. So off I went to Germany for 18 months, which I loved. It was really good experience for me, experience a different culture, a different language. It opened my eyes to living and working off the island, which actually, in hindsight now, was one of the best things that I did. When I was in Germany, I applied for midwifery again, and I got in the second time, which was great. So I came back to Inverness, I did my midwifery training, and again was looking for jobs at the end, and I ended up in Skye, where I had really enjoyed being a student nurse, and I was a community nurse, midwife, family health nurse and nurse prescriber there for 13 years. Thoroughly enjoyed it, and then I came back to the island. I worked in a nursing home for a year on night shift. I also worked in occupational health for, I think it was about 5 years. And now for the last 4 years, I've been the Parkinson's disease nurse specialist for the Western Isles. Oh, that's a difficult one, but what I would say is both the service and myself have had to adapt through COVID to meet the needs of the patients in these very strange times. By that I mean there was no face-to-face reviews allowed, which I found difficult, because part of your assessment is you're assessing somebody's movement. With being a Parkinson's nurse, not being able to see somebody and having to do that by telephone was a strange way of working. In saying that, we had already been set up with Attend Anywhere for the service, so if patients had that, I could see them over telemedicine. If patients didn't have a laptop or an iPad, then I was able to help them get one and enable them to see either myself or the consultant neurologist, who was also using telemedicine, and Attend Anywhere. Another thing that makes me proud to be a key worker in the pandemic is the fact I was, with my other role as occupational health, I was a vaccinator anyway, and I had helped out previously with the flu vaccine. I was able to help out this time with the COVID vaccines by doing the training for that, and also help out with the mass vaccination clinics. As long as you are doing what makes you happy, that's the most important thing. I've been happy in each of my jobs, and although I have changed jobs at different parts in my life, as long as I was happy and healthy, that's what was important to me. The last thing I want to say is it's important for you all to know that there is no wrong path. You can start off one path and go on to another. You can chop and change at any one time. Just as long as you're happy and healthy and kind to each other, that's the main thing.